so let's just say, let's go back to the home screen. Let's say, okay, we're starting from blank. So let's just say we have nothing selected. Okay, we'll go to our scheduler for today. Let's say, okay, we have this patient scheduled for a comprehensive exam. We're gonna right click, select patient, and then you'll see the patient is now down here. That means the patient is currently selected. And then we'll go to their EHR, which is their electronic health record. And we'll make the screen big. Okay, and at this time, what we'll do, go to treatment history. They have nothing. They do have an appointment this afternoon at 3 p.m. Nothing in progress, okay? Okay, so we'll start from, go to forms. There's no form in here. If there's a referral in place, a lot of times it'll be here. Specifically, if they come from screening, there'll be a screening form which you can double click on, and it'll say why they were sent to GPR and not any other clinics. So it'll say, like, for example, patient is on dialysis, or patient has a complex medical history, or they have a history of head and neck radiation, but it'll just have a little form, and that's the quickest way to figure out why they were sent to GPR. The other thing we can do is go to forms, med history, and they should have filled out a medical dental questionnaire at some point. If they didn't, that's the first thing they'll do when we sit them down for a comprehensive exam. But if they already have this med dental history questionnaire in, you can go ahead and open it up. Okay. It looks just like this, but it'll be all filled out. And I'll go through their dental history and then a more extensive medical history. And you'll want to review this obviously before they get in. Okay, we've looked at that. And once again, if they don't have that, we have that paperwork for them to fill out, and we'll scan it in when they're done. All right, and so the next thing we do is a lot of times they'll already have a Panorex if they've went through screening. So you can use this patient number or the patient name to go into SHIG, which is that little white icon. That's where we keep all of our x-rays. I think it's labeled like CDR drive on the computer. It's a little white square icon, okay? And so we'll go through the Panorex as much as we can, and just update their odontogram as well before they come in. So before they come in, right, we review chart, open patient chart. Do they have a medical dental questionnaire? If yes, let's kind of review their medical histories, kind of know the important stuff to ask questions about. If they don't have it, we'll get them to fill this out first thing. We can go to forms, see if there's any kind of referral form in here, and then we'll look at the Panorex and see if we have any kind of information. If we do have some information, we can go ahead and click this plus sign, which is create new record. You can do here or here. So we'll just create a new record. And so let's say, okay, this patient didn't have their wisdom teeth. We'll select all these, and we'll right click and click missing. All right, and let's say maybe they're missing this tooth right here. Just pretend we're looking at their Panorex. We're just putting some information in. So you see here, there's some dental treatment. So this is when we can plan stuff. We'll want to go to findings. So I'll just pop in, okay, this patient's got few occlusal fillings. That is done. Let's see, they've got a PFM crown down here. Let's say this one's shifted into the space, and this one's shifted into the space. These are just kind of makeup things. Oops. So these are all adding in pink. They're adding in as findings, okay? So let's see, we'll just put there's some kind of cavity. And say we've got maybe some moderate occlusal cavities over here. Maybe a little. All right, so we've gone through just from the Panorex and the odonogram, updating as much as we can. So marking things missing, marking previous restorations. Let's say they've had a root canal there. Okay, and it kind of color coordinates anything, and this makes it great so you can just glance at it and generally have an idea of what's going on. After this, you can go to the treatment history and say, look, all these pinks are in the findings, okay? And then, all right, so then we'll go in, we've done all this pre-stuff, we've gone through their med history, we ask any questions we need, determine if we need a med consult or clearance or anything like that. And then it's time to go in and see the patient. Should have a blood pressure, kind of review medical history with them, talk about chief complaints, okay? Discuss chief complaints, and then also just kind of like what are their goals? What are the patient's goals for this treatment in general, like eating, aesthetics, function, just to not be in pain, to stabilize, because all of our patients have specific needs and goals that we kind of tailor person to person. And so after we do all this, right, you'll go in, talk to them, and then we'll take a full set of x-rays and FMX. Either the assistant or you will do it. Kind of depends on who's available, what our schedule's like. We all kind of work as a team. And then after we take that full set of x-rays, go through and do your intraoral and extraoral exams, looking at everything, talking through some different options, okay? And so let's just say we've done our exam, we've got our med history, we've got everything done, okay? Let's just mark this one as missing too. Okay, so then there are two ways you can insert treatments, okay? For comprehensive exams, we like to do a full treatment plan here and have them sign it that day. Sometimes, so this patient is a lot more straightforward, where there's not a ton of options, but some patients have quite a few treatment options that changes based off of what they can afford, what their needs are, what their wants are, what's the best option for them personally versus financially, what can we work with. So there's kind of a bunch of different things to think about and consider. Also, can they tolerate this? Will they be able to keep up with this denture or this restoration? So it's pretty subjective. But let's see here, it's a lot easier. So let's just say this patient just needs, so let's say we did the comp exam. We'll need, and also, so for these treatment planning codes, you can either click what I'd recommend to do is click the ... every time, go to quick list and go to GPR. All these codes are correct. So these are codes specifically for us. So diagnostic, we'll do an FMX and try to sequence stuff at least a little bit. Makes it a lot easier for everyone, the schedulers, the patients, to understand kind of what's going on. So let's just do, so she's got no perio. Call that phase 1, 0, and then we've got those 2 little cavities, GPR operative, 2, 1 surface posterior, both of these. We're going to make those sequence 1. Phase 1. Okay. So we've got comp cleaning those 2 fillings. Okay. And let's say the patient's chief complaint is he's not worried about this side. He's just saying on this side he's getting a bunch of food stuck in that space. So we give him some options, right? We talk about crowns versus, or bridges versus implants. And he decides he wants to do an implant. So we'll do the implant crown macro code. Click it to this spot. That's going to be phase 2, sequence 0, because we're going to do the fixed stuff. Okay, and so now here's kind of an important part. For implants specifically, oral surgery is going to place the implant. So we shouldn't need that. We don't need the cone beam CT. They will need the implant abutment supported PFM crown. And most people aren't getting this custom abutment made. They're just using stock abutments. But I keep it in because I'd rather overestimate versus underestimate. And then we click OK, and it should process through. So look now. So we updated this picture. We've got just an exam, the x-ray, the cleaning, these 2 little fillings to be done. This space is not bothering him. These teeth have shifted over. We're just going to leave it. Patient is not interested in a bridge and it's okay to do this implant. And what I always write when I print these out is that there's a screw part and the tooth part for the implant. The oral surgeons are going to place the screw part. And so the screw part for them is about $1,500. So I always write that at the bottom so they know that they're 2 separate prices, because that's really important, is to explain how the implant screw is different than the price of the implant crown. They're 2 separate things. Okay. And all these codes are important because it determines what their insurance is going to pay for and everything. So we do, once we get a full treatment plan in, okay, it looks good, I'll approve it, I'll close it, I'll go ahead and print it out, I'll bring it to the patient, talk through it with them, pull up pictures on my phone if I need to explain stuff better, and just overall talk through this with them. And it's pay as you go. So if next time we're just going to do the cleaning, then next time they just have to pay for the cleaning. And if next time we're going to do the filling, then that day we just have to pay for the 1 filling we're going to do. And so people sometimes get stressed out about this, the price for the crown, but I always let them know that for the implant crown, you've got at least 6 months until we can even worry about making a crown. So that gives you a little bit of time to make some money. Okay, and then you just if the patient's okay to sign for that day, preferably have them go ahead and sign. Sometimes they want to think about it, or they have multiple options and it's kind of a lot. And so sometimes, depending on the patient too, if it's really complicated, I'll just make a phase 1 treatment plan where it's just, we're not worried about replacing teeth, we're not worried about crowns. Let's step 1, get you out of pain, get everything stabilized and everything healthy. So that means extractions, fillings, SRP, prophy, everything before kind of replacing missing teeth or doing more long-term stuff like crowns. So you can also split it up like that. The only thing right or wrong is that we have to have some kind of game plan. So it doesn't need to be full front. Like this one's a little bit easier because it's pretty basic, but some patients you're going to get where there are multiple options and there's so many options. So just try to simplify things, because too you can overwhelm patients by giving them too many options. So if they're like really complicated cases, I'll be like, okay, there's a lot of options. Let's step 1 focus on what we have to do. So we have to pull this tooth, or we have to do this filling, or we've got to do this. No matter what treatment choice we choose, this is going to happen no matter what. And that's something we can talk through as you guys kind of have these patients. But this is just for some general workflow. Okay, so patient accept print. You'll go over this with the patient. They'll sign it on the little keypad that is on the computer. And after they sign this, it'll say date accepted. So if they signed it today, it'll say today's date, 6/1. And then it moves everything over here automatically. So once they sign this treatment plan, all of these treatment codes populate under their treatment history, and they'll be in red. And so let's pretend like we didn't sign it today. So we'll create a new record. So dental treatments, we're under findings, so we added what we found earlier, right? Existing stuff. And now we'll want to go to dental treatments. And then we'll go to GPR. And so because the patient wasn't ready to sign today, those treatment codes wouldn't auto-populate into the treatment history. So we'll just go ahead and plan this comprehensive exam today and plan this FMX. You can also just go ahead and complete them initially, so I can just complete. Okay, so see how they've populated down here in red? So that means planned, but it hasn't been done. So if the patient signed this treatment plan, all of these treatment codes would be over here just like this in the red. There'd be the whole list, okay? And so he didn't want to sign today, so I just went ahead and added these individually, and then I will just, oops. Didn't mean to click that. Select them both, and then I can click complete treatments, and it'll turn them green. Okay, so let's just complete them for today, just to pretend. Like I said, if they sign for the day, you won't have to add them. They should be under here. Okay, so I've completed these for today. And so patient is Art Robbins rescheduled them for next appointment to confirm treatment plan and sign and to do the prophy. So then that's easy peasy. And so now, main thing when you're finished with your patients, you need to make sure whatever you did today that there's a code coded out, okay? And we got to make sure they're correct codes, because that dictates what their insurance is doing. Okay. You always need a note attached to these patients. So we click the white square here at the bottom. We'll click OK to general note. ... Now, okay. We have these 4 main notes for us: GPR consult, GPR extraction, GPR operative, and GPR prophylaxis. I personally don't use the GPR soap notes. They're more set up for hospital dentistry, which is fine. I just find these to be easier. So we didn't do a prophy or operative or extraction, so we'll just do consult general note. Okay, see what I did wrong there though? I did not double click it, and it's got to be once it shows up down here. So you can do that, or you can like highlight it and just click down. I just always double click it normally. Okay, so we'll just say, okay, so down here you can just quickly look, it says F46. Just a female 46. Her chief complaint: take care of my teeth and I keep getting food stuck. Right. So let's just say, so this is where, make sure you're looking at your medical questionnaire right, looked at it, we already talked about it. So let's just say patient had MI 7 years ago, currently on Eliquis. See scanned. Let's say history of present. So HBI's history of present illnesses. Patient has not seen dentist. Current. Applicant for stroke 7 years ago. Say scanned. Significant for Eliquis. Allergies disclosed. Let's say her BP 136 over 80. Let's see her pulse is like. So we did a comprehensive. And also, so if everything is put in your treatment note or treatment plan and your odontogram, like if you chart your caries and you chart your previous restorations, you don't have to write as much in your note. So dentition is good. So we'll say gingivitis, missing, dentition. So just kind of think of all the treatments. We're going to do a cleaning for gingivitis, implant for missing dentition. Caries. Okay. Can delete this collected because Miss Robin is going to make sure we collect whatever we need to be collected. That's also why everything needs to be charted correctly and notated correctly, because it's not just you that has to go back and look at these notes. It's the schedulers, it's the insurance people, it's a lot of people looking at these documents and using them. So they need to be able to look at your document and understand what you did, kind of why you did it, and what the next steps are. So here I'll just put like kind of the important things. So his is pretty straightforward, like occlusal caries, missing 20, missing 29, right? So missing 20 and 29, 30 and number 31 have shifted measly into space. Patient Let's say, yeah, he doesn't want a bridge, but let's say maybe he hasn't decided yet. So next visit, prophy, injury, sign treatment plan. The main thing is this next visit needs to be very clear for both the scheduler and the patient, because that also determines if they're paying, how much money they need to bring, right? So for these comp exams, the easiest thing to do, bring them back for cleaning, or if they're in pain or anything's hurting them, be like review, filling, and do whatever's causing them pain. This is easy, low stakes. Bring them back for cleaning. We can answer any questions they have, kind of make sure we're all on the same page. And after this, all right, next time we're going to do those fillings, And then we click add new. It'll say a bunch of stuff is spelled wrong. Some of it is. Oops. All right, so now if we go to the treatment history, we'll go to station view, so make sure we can see everything. Okay, let's go up. All right, so today we charted that we found these shifted mesocysts, the pinks are the findings, We found some caries, right? We completed a comp and an intraoral FMX. Noted all this other stuff. I'll scroll down to the note. Alright, so this lady, 46 years old, she wants to take care of her teeth, hasn't seen the dentist in a long time, no pain, was sent to us probably because of stroke history, was 7 years ago, so something we're not as concerned about. She is on Eliquis. We have scanned in her full past medical history, her med list. That's another thing too. Sometimes these patients are on so many medications. Some of them have a good med list handy. If they don't, it can be a little bit of a problem. Just come get me or talk to me and we'll just try to do whatever's the least invasive, like a prophy, and ask them to bring a med list to that prophy appointment. Okay, so she didn't disclose any allergies, got a BP, got a comprehensive. We did our extraoral intraoral exam, didn't see any path or swellings or anything that's concerning that we want biopsied. Overall, she's got gingivitis, some missing dentition, some caries. We did today a comprehensive exam and FMX. She's got some mild gingivitis. She's missing 2029. So when I'm looking at this odontogram too, the only thing that's not treatment planned is this 29, right? So then in my head, I'm like, what? Is he okay with not doing anything? And that's why we wrote that here. Missing 2029, 3031 of shifted measly into space limiting restorative space. Patient is not concerned with space on 29. Great, done. Another thing is, why did we talk about a bridge? Why is he treatment planned for an implant? Okay, patient would like an implant, does not want a bridge if finances are not an issue. Right? And so Miss Robin can look at this too and be like, okay, this is kind of these important blebs they talked about. And then treatment plan was printed and given to patient. We'll sign at the next appointment. All the questions are answered. Prophy, review, and sign treatment. Okay, another thing I actually wanted to show you is, so if he wanted to do a bridge here. Okay, so we already have this first treatment. We'll label this one as implant on number 20. Okay, so now you can see this is an implant on 20. We're going to duplicate this. Implant on 20. We're going to delete this. And for some reason, I don't know why it won't delete the picture. We'll delete that real quick. All right. So if he was interested in the bridge and wanted a price differential, we'll do crowns. Just say it's zirconia. Do these here. Crown on 19 and 21, and then we'll need to add Pontic. get them to add the Pontic to the quick list, so y'all shouldn't have to worry about finding. Okay, and then we could print this out for him. So if you didn't have to decide for today, or we could just make a treatment plan with just the 2 fillings and the cleaning for now, just to get him to sign that part and him to have plenty of time to think about this option. Kind of is dealer's choice. On how you kind of want to, if you want to do phase 1, phase 2. His is a little bit easier, but if they have more extensive treatments, you're probably not going to want to do kind of the multiple options. You can just be like, okay, let's do the half-twos. The half-twos in this case are the cleaning and the 2 fillings. That'll at least get them through phase 1. But if you do get to phase 2, like for this guy, so now you have an implant 20 treatment plan and a bridge 20 treatment plan. This one's black because I've already approved it. But this will show you. So implant on number 20 is going to be somewhere around this $1,675 for our fees. Now remember, for the implant fees, oral surgery is going to have their fee for the screw price. So that's about $1,500. So that'll be somewhere up $3,175 total for the implant. So for the bridge option, we're about $2,500 for that price. So you see, kind of, it gives them some time. They can take both printouts home. They can do some Google and researching for themselves. But also in the meantime, we can always just, if they're like, even next appointment, if they're like, hey, I don't know the answer, and it says review and sign treatment plan, that's fine. We'll just completely remove these. And we'll just do phase 1 only. We can have them sign this one. Okay, but the main thing is when you're done, go through the schedule or go to whatever patients you saw today. So I saw some other ones. I went through and made sure I closed out codes. Okay, so I go through. Okay, I have my note. Got everything for next appointment. Make sure if you need to email any scans or email or write any lab slips or send any prescriptions in, do that. You'll also add that in here. So if I scanned anything or have anything to send out afterwards, and we'll go ahead and do that. Or if we've got stuff to pour up in the lab, do that as well.